Hello, everybody. This is Dr. Howard Robbins, uh, live and in person for Functional Medicine with me, Dr. Howard Robbins. Our podcast on Voice America is going to be starting shortly. We have Dr. Maxine Mayreis as our guest today. Hello, Dr. Max. I've known Dr. Mayreis now for many, many years. She's not very good at being a chiropractor. She stopped being very good many years ago. She is amazingly wonderful and expert and brilliant at being a chiropractor.
You're very kind.
I want everybody to understand that. You're dealing with an expert, and she has a very long history that you're going to hear about. I'm not going to go into it now because we're going to be talking about it in a few minutes for literally the entire world to hear. Here on Voice America, the internet station, we're heard on the Health and Wellness Channel, and we're heard now in over 70 countries. And the best part about our show is you can listen to any one show you want. We're not a news channel. So we're just not giving you the latest and newest day by day, tune in every day to hear what else is new kind of show. Many health shows work like that. We're here to give you very specific health shows that are designed to teach you how you can overcome medical problems that are virtually unfixable sometimes in the eyes of traditional medicine. Traditional medicine is also very ego-driven. I know because I was brought up in it. And what that means, and what I mean by that, is many doctors have their opinion about what is okay and what isn't okay, what you should do and what you shouldn't do. And basically, they make these opinions up on what they've heard or what they've been taught, not what they know, not based on their own experience. And that's a very sad thing because they have different opinions then about other methods of healthcare, such as chiropractic, and many of their opinions have been proven absolutely outrageous and unfair. We have a very, very important show today on chiropractic, what it is and how it can help change your life, literally change your life, give your life back. First, I want to thank PromoLife. PromoLife is one of our two sponsors, PromoLife.com, PromoLife.com. PromoLife makes Ozone products. They make medical grade ozone machines for home care use and for doctor use. The doctors use the ARC machines. People, mostly the listeners of this show, though we do have a lot of doctors listening around the world, as we're now heard in over 70 countries, people need their elite model or their elite plus model to do most everything you need done at home. Doctors get the ARC and the ARC Plus model. ARC Plus is what we use. It's an extremely high quality unit and affordable. And that's very important. They also sell a whole range of home care products like saunas and ozone saunas and other things. When you go to their website, look at all the different things, see what might help you and fit into your life health needs. And when you call them up, make sure you tell them, don't go call them that. I mean that. Don't just order online. Go to 888-742-3404. That's 888-742-3404, and tell them you heard about it here on Dr. Robbins' show, and they'll do something special. They'll give you something off, or they'll throw in something for free. They treat everybody like family. Then I want to thank Doctors Biome. Doctors Biome is a very important, necessary, for everybody listening to this show, probiotic beverage. You may say, well, I already take probiotics. What do I need it for? Well, capsule, powder, and tablet probiotics are destroyed over 90% in your stomach. Even if it's in capsule form, capsules may not even open. Doctor's Biome is 15 patented next generation strains of probiotics. Next generation means they're created to survive the stomach over 90%, and they're living in a 100% organic mint, kale, lettuce, cucumber, celery, apple, lemon juice. So it's delicious. Babies can take it. Children can take it. And many of my patients even are feeding it now because it's very healthy for them to their pets, to their dogs. Not some dogs just lap it up. Other dogs, you got to use a little syringe without a needle, of course, and squish it into their mouth. But it's an extremely healthy and beneficial thing for all of them to have. And many dogs have been given antibiotics. If your dog has been given that, they may eat meat or chicken in their food that may have, with unbeknownst to you, antibiotics in it. You can't burn it out of the meat or chicken. And thus they've killed all the good biome, all the good bacteria in their gut, which puts them at a disadvantage in their health and shortens their life. You can give them Doctor's Biome in small amounts. They don't need an entire 2-ounce shot based on the size of the dog. And of course, you should be taking 1 2-ounce shot every day. Also, they're called smart probiotics. They actually stick to the wall of your gut where you need them. They don't just aid digestion like acidophilus does in kefir and in yogurt, or even in sauerkraut, which is good to aid digestion, but where we need them is in the wall of the gut. And that's where Doctor's Biome products just work so well. There's gut health, women's health, and now a medical food that has shown superior in helping treat and eliminate C. difficile infection. Go to doctorsbiome.com, doctorsbiome.com. And if you use the code radio20, I believe you'll get 20% off your first order. And then if you go on auto ship, you'll get 10% off your order from that point on. It's not a cheap product because nothing good is cheap and nothing cheap is good, but it works. It makes a difference to your health, or I wouldn't be allowing it to be one of the promoters of my show. All right, everybody, doctorsbiome.com, code radio20. So today we have Dr. Maxine Mayreis on. Dr. Max has been a chiropractor almost her whole life because she was a nurse to start with and then decided to go into what you might want to call the family business. Her grandfather was a chiropractor. Her whole family has basically been chiropractors, dating back to, I think, as early as 1914, when chiropractic was just a brand new, hardly known even method of healthcare. I could not be living without severe pain in my back because of 18 years of playing judo if I didn't have chiropractic adjustment done regularly. Sciatica, I mean, you can start listing all the different things that chiropractic can do, and we're going to be talking about them, but it's very important to understand all the nerves to all the organs and therefore all the systems in your body, including your immune system, come from your spine. If your spine is not in proper alignment, you can't have a functional immune system. You can't have a functional pancreas. You will. This is part of why people lead to many diseases and conditions that could have been avoidable, because you need the proper nerve impulses to make all these organs and systems work correctly. So it isn't just about back or neck pain like many people think. And that's what we're going to be getting into. So let me welcome Dr. Maxine Mayreis. Hello, Max.
Hi, Dr. Robbins. It's wonderful to be here. I'm very excited to be on your platform. It's quite an honor. And so you just explained the neurological basis for disease. I'll start by explaining what chiropractic is beyond what the basic introduction that you gave. And as you stated, I am a third generation chiropractor. I'm the sixth in the family. And so I've been adjusted since I'm knee high to a grasshopper, you know. And chiropractic understands that the nerves control and coordinate every function in your body. That means it controls whether your heart is beating regular or irregularly, and whether it's beating strong or weak, whether you're breathing easily or whether you have inflamed windpipes, and whether you're struggling to breathe, whether you have a cough, how your immunity, as you said, is functioning, how your cells reproduce, how your hormones are working. And that's not just sex hormones. People think of hormones as your estrogen and your testosterone. Truly, they're hormones, but there are lots of other hormones, hormones for digestion, hormones for keeping calcium in your bones, hormones for controlling your blood pressure, lots of hormones. And the balance of hormones is controlled and regulated by the nerve system. Also, your digestion, whether you can poop or not, whether you're constipated, whether you go to the bathroom, whether you have gas, bloating, reflux, indigestion, digestion is controlled by the nerve system. And of course, your muscle function, whatever you can think about in your body that happens, it's controlled by the nerves. And the nerves we're talking about, 80% of it is your brain. And then the extension of the brain is the spinal cord. I don't have charts here. I have an eye chart, which is great, but yeah, and I have part of a spine over here. But so your brain has an extension. It's called the spinal cord. And the brain has to send messages to every cell, tissue, organ, and system in your body, to your heart, your eyes, your liver, your intestines, your pancreas, your prostate, your ovaries, your legs, your arms, everything that you have to control its function. So how do the messages get from the brain to the body parts? Well, the brain starts the signals and it goes down the spinal cord all the way down to every cell, tissue, organ, and system in your body. There are branches that peel off the spinal cord, just like envision a power plant. We used to call it Lilco. I guess it's called PSEG now. And they made the power, and they would send it out to all the residences and all the businesses in the community. And as the conduit would travel from the power plant, it peels off a line going to this business and to that residence. And the spine functions the same way. The signals come down on the spinal cord and they peel off going to all the organs in the body. So because this is the system that controls and coordinates all the functions in the body, it's so important. When they designed it, they put it completely in bone. And you have this skull here, bone protecting the brain, and you have 24 movable vertebrae in the spine. Actually, I can probably pick it up and show you that all these 24 movable segments in the spine, they have between them, they have discs, okay? And the discs, as you may know, the discs are cushions, right? But they're also spacers because between the bones come the nerves. You see these fibers here? These are the nerves peeling off the spinal cord going to your organs. And the nerves pass through a hole. And if a bone goes out of alignment, you see, then it pinches the nerve, okay? Then the nerve gets pinched. And does it create pain? Well, sometimes, yes, but not necessarily. And you know why? Because 90% of the nerves don't feel pain. They don't sense touch, pressure, heat, cold, and pain. But what they are there for is to bring the messages from the brain to the organs. So when the bone goes out of alignment, now some of the signals, or all the signals maybe, are interrupted, or some of the signals are distorted like that, or they may be cut off completely. So is that organ going to function well? No, it's not. It'll have, if this is the power plant, then there's going to be brownouts or blackouts in the organs. So picture also a circuit breaker panel. You know, if you flip on the switches in your house and the lights aren't coming on, and you go into the next room and still no lights, you think all the bulbs are blown? Well, you could replace the bulbs, but that may not fix it. Or you could replace the wall switches. But if the lights still aren't going on, then you have to get to the root cause of the problem, go to the circuit breaker panel, and when you open that door, you'll see all the switches all lined up, and then you'll find one that's not in position with the others, and that must be the problem. When you flip it into the on position, voila, the lights come on. So this is how your nerve system works and how your body is regulated by the nerves. So what does chiropractic do? Chiropractic looks for those bones in the spine out of alignment, pressing on the nerves. And if you don't do that first, let's say you have a symptom, let's say you have irregular heartbeat, or let's say you're constipated, or pick a symptom, sciatica. If you don't look to see if that nerve is pinched, that's a basic fundamental of fixing the problem, wouldn't you say? Because no matter how much medicine you do, or how much traction you do, or no matter how much supplements you take, you're not going to restore the function of the organ. So what we do in chiropractic is we look for these bones out of alignment, and they have a special name. It's called vertebral subluxation, because these are vertebrae and they're out of alignment. And so what we do is we examine your spine, because that's where God put the nerves. If God had put the nerves in your foot, we would be foot doctors. But God put the nerves in your spine, and that's why we're always looking at your spine. So people think we're experts in scoliosis and sciatica, pinched nerves, and we are, absolutely. But what our main philosophy is to remove the interference to the nerve system working right and restore the communication between the brain and the body parts, and then stand back and let the power that made your body, coming from your brain, heal your body. Without that connection, you're only going in one direction, and it ain't up, it's down. So when Dr. Robbins said it could be life-changing, it truly is, because as long as you have vertebral subluxations, or as long as you're subluxated, as we say, then you can't expect to have good health, no matter what else you're doing. So that's why chiropractors work on the spine. That's where God put the nerves. And it's very simple. It's not more complicated than what I'm saying. So actually, when I make an adjustment, I always say, well, now the communication is restored between your brain and your body parts. And I say your power's on. And now you're healing from above down and from the inside to the outside, because healing comes from inside. With the vertebral subluxation, it's blocked up. It's suppressed. It's not working. It's not being expressed. And the opposite of life and function is being expressed. And you can imagine what that is. That's degeneration, deterioration, sickness, decrepitude. I don't know if that's really a word, but I made it up. So when you get adjusted, it's an anti-decrepitude way of living. And chiropractic is a lifestyle. People say, well, people mostly come in with pain, and they know that we're going to work on their spine and get to the root cause of their problem, and we do. But every time they come in, I always explain to them what chiropractic is really doing. So we have a meeting of the minds, and we're on the same page together. So if their expectation is just, okay, adjust me so that I get rid of my pain, that's nice. I want you to feel better. But what I'm looking to do, and find out if you're interested in the same thing, is to actually fix the root cause of the problem. And it takes frequency and repetition. It's not a system I invented. It's the way it is. I always say, if I want to become Miss America, it would take more than one visit to the gym. It might take more than 5 visits to the gym. I have to retrain the nerves and the joints and the muscles and their tendons and their ligaments and the fascial planes and everything that you have. They have to be trained, because as soon as I correct the subluxation, move the bones off the nerves, it will slide back into that pattern, into the bad pattern. And we have to correct it. How long do you want it to be there in that bad pattern? A long time? No, you want to do it short. You want to do it quickly.
It's very important for everybody to understand. A lot of people go to chiropractors just because they have a back pain or a neck pain. And that's a very good reason to go to a chiropractor versus taking pharmaceuticals to try to just Band-Aid the pain problem. By covering up the pain, you're not getting to why you have pain. And when the medicine wears off, you're taking another painkiller again. And I'm not to put aside all the negative effects of constantly taking pharmaceutical medication. Or you could be taking homeopathy, arnica, for example, for pain. Well, that's fine. There's nothing harmful about that. But Why don't you want to get rid of the cause and stop the pain from happening in the first place? Um, and one of the things that I can honestly say is chiropractic isn't a one-time thing. You don't just go get fixed and then goodbye. It is your body goes, and this is the way I like to put it, Max, Dr. Max, is it goes in and out of alignment all the time. Now, if it goes in and out all the time, I believe that's not a problem. It's when it goes out and locks that you need a professional locksmith to unlock it again so it can be it can move in and out naturally again. I mean, we're not a stiff box where we're moving parts, and that's what a chiropractor, I just thought of that as an idea, is actually a locksmith that picks the lock, puts things back, and lets us move again, and get them, and of course getting that right nerve innervation to all the organ systems. Many people don't realize that if you have an autoimmune problem, if you have constantly getting sick, it isn't about, oh, eat the right foods and I'll boost up my immune system. It isn't about just uh, taking the right supplements or doing the right exercises. You have to have the right nerve innervation to all the organs, and this is where chiropractic comes in. And unfortunately, human bodies go out of alignment all the time and often lock that way. So regular chiropractic treatments, I think, are vital for virtually everyone. So we're here with Dr. Maxine Mayreis, and we're talking about the miracle and benefits of chiropractic. Let me ask you, first of all, how young, what is the bottom age and the top age that a person can be to get adjustment, and what's the differences?
I love that question. I'm so glad you asked. I also need to say that the way you describe chiropractic, the benefits of chiropractic really blew my mind the first time I met you. I almost fell over. I couldn't believe this medical doctor understands what I do, because most medical doctors don't have that. They don't understand that. They have no concept of that. So I appreciate that very, very much. So how young do you have to be, or how old do you have to be adjusted for the first time? Well, just consider the birth process as a start. When the baby comes out of the mother's birth canal and they turn the head around 180 degrees this way to clear a shoulder, and then 180 degrees the other way to clear the other shoulder and pull. There's 94 foot-pounds of torque on there. And so it can lead, and often does lead, to the baby's first vertebral subluxation on the very first bone at the very top of the neck. And they call it the atlas vertebra. You know why? Because it's holding up the skull and it houses the brain stem. And so the brain stem is pretty important part, that's where your basic functions are. Lizards don't have much thought processes, but they do have brain stems to keep them alive for breathing, blood pressure, and heart function. Okay, so the brainstem's a very important area, and all the signals going to every part of your body are coming through that brainstem, and also back from the periphery and the environment back up to the brain to tell the brain what's going on with the body parts and the environment. So if that atlas can be subluxated and obstruct signals going down or up between the brain and the body parts right here at the get-go, at the power plant, I would say that's not going to bode well for that baby. And so then you can expect digestive problems and breathing problems, pneumonias and asthma and all kinds of things going on. And so that's why I feel that there should be a chiropractor present in every birth. Even if they are born by cesarean section, which we do a lot of these days, and I have special feelings about that too. Because when the baby comes through the birth canal, they get the mother's biome. That is
Yep.
so important. And
Yes.
not many mothers understand the importance of having the baby come through the birth canal. Anyway, I shouldn't digress so much, but I feel strongly about it. So babies, when we adjust the babies, it's a different technique from the way we do more mature young kids, or older kids. And so we do infants at birth, we do toddlers, we do preschool kids, we do school age kids. We take care of young adults, middle adults, older adults. Everybody who's breathing and has a spine deserves to have a clear nerve system and function at their optimum ability. So I love that question about how young do you have to be. So in my practice, we take care of lots of kids
Is it
and
painful?
women.
You know, a lot of people don't, when you don't know, you don't know. And a lot of people have heard all sorts of things. There's many different ways to make adjusting. And, you know, some people say, oh, I went to one, it wasn't any good. There's two questions here. The first is, and I'll make a statement first. When I was in medical school, we were given a practice management course, and something had come up, and the professor who was teaching us this said it because a patient was coming on to him, a female patient was coming on to him. He goes, you know, it's hard to find a good lover, but it's even harder to find a good doctor, and that's how he would put her off because he didn't want. He obviously, a married man, didn't want to get involved with a patient as he shouldn't. But I took that and I thought about it and I said, it may be hard to find a good doctor, but it's even harder to find a doctor that's a healer. And all chiropractors are not created equal, as all doctors are not created equal. So, how do you find a great chiropractor? What should you look for? What are these qualities that they should already be hearing and seeing in you? What are these qualities that they should be looking for?
That's a great question because I definitely do not recommend going into the yellow book. If anybody here knows what a yellow book is, or going online and just picking a chiropractor out from a listing. I prefer that you go by referral. It is important that you wind up in the right hands. Not that anybody's going to hurt you, because what we do, chiropractic is the second largest healing art on the planet, and it's safe, gentle, and effective. Remember that it's safe, gentle, and effective. Nobody's going to hurt you, but you want the results that you need and deserve. So I recommend that you go on referral by someone who's excited and has great results and likes the feel of the office. But if you don't have that advantage, then you should be looking for a practice that says family chiropractic, that they do babies and children, that they have healing or optimum health or life center in the name of their practice. If it says back and neck pain center, well, that's like it's a different philosophy. It's like a spinal mechanic, and you'll probably get well. But you know what? There's something about the magic in the adjustment by a healer and somebody who understands that when they make that adjustment and release that obstruction to the communication between the brain and the body parts, then the magic happens and your power is turned on and your benefits are limitless. And so, you know what? One thing that upsets me is when I always explain to patients that their children should be checked, you know, regardless of whether they're having their symptomatology or not, because you know why? By the time they get the symptoms, the body's beyond its ability to adapt, whatever the problem is, their subluxation or whatever. So don't wait for symptoms. It's like a toothache, you know. Why wait for toothache? Don't you know to get your teeth checked every couple of times a year? You know, even if your mouth feels good, only the oral specialist knows what's going on in there, and he or she needs to check that. So by the time you have a toothache and you're out to here, wow, my face is killing me, you might need extraordinary procedures or lose the tooth or something like that. So don't wait for that. I explain to people to have their children checked because they enjoy the same health benefits and freedom from illness that they are getting. So in choosing a chiropractor, go by referral, find somebody who's been practicing a long time as well. If you were taking your car for service, would you like to go to the guy who graduated yesterday or the guy who's been doing it for years? I'm sorry, I always felt that way. Even as a nurse, I felt I'd rather see an experienced doctor, an experienced nurse, an experienced whatever the profession is, because they've been there, done that, and seen it all. And they've evolved to the realm of being a healer, most likely.
I want to be fair by saying sometimes people are highly skilled and special at what they do. And even though they just came out of school, they may be brilliant in their ability to help a person heal and get well. They're true healers. And just because they haven't you started out and I started out with no experience other than schooling and
I guess we did.
residencies.
I guess we
That
did.
didn't make us less than what we
No.
are, though
Yeah,
we do learn as we go on. We get better at it, perhaps. But young people that are just out may be very good. But I go along with you. What I like to hear is, and I tell people, get referrals from a family member or friend, and the key words to ask are, how do you feel after you get an adjustment? Oh, I feel wonderful. I love that doctor. He is so great. You want to hear those kind of adjectives after when they talk about the person, and that guides me to feel, well, this might be somebody of quality who can help me. They may not be able to help me, maybe they're better for the other person than my body, but this is the way I like to look for someone, that they should be special and somebody feels that way about them. They've been impressed.
yeah,
So
that's true.
let's talk about this. We've got about another 8 minutes before we go to our last break. So let's begin with, what kinds of conditions respond well to chiropractic? What do you tend to be brilliant about and hit home runs all the time? And where are you less beneficial, if you want to, if that is the case, where people may not be wasting their time, but may only get some benefit and not real major improvement?
Well, so conditions that respond to chiropractic, it's pretty well known because in New York State, we are pigeonholed into treating conditions of the spine and nerve compression, sciatic and pinched nerves and stuff like that. And so if you or anyone has sciatica, chiropractor is the first place you should be, or a pinched nerve anywhere. That you're feeling the symptomatology of pain going into your shoulders or down your arm or tingling in your hands or feet or something like that. But I have to tell you that I can't say that I treat digestive problems, and I can't say that I treat asthma and allergies, and I can't say that I treat headaches, because chiropractors
No,
only
but I
treat
can
one
tell you,
thing.
Max, let me interrupt. Here's how you say things. I had to learn this too. I have seen I have seen improvement in fill in the blank. I have seen. You can't say you treat something if it's out of our legal scope. The people
That's
have to
right.
listen. This is the United States of America. It is the home of the brave. It has never been the land of the free. It may be the best
Right.
country in the world, in my opinion, to live in. God bless you all from all your countries. But this is the home of the brave, not the land of the free. Many countries are very controlled, particularly healthcare, and you have to be careful how you phrase things. But I have seen many things happen with ozone therapy that, if I were to treat them, would be out of my scope, medical licensing. But I have seen these things, and that's how I like to say it. So why don't you tell us what you have seen in your
Yes.
career?
Yes, exactly. So after I explained to the patient that the client, the practice member, that what we're going to do is free up the communication between your brain and your body parts so it can function the way it was designed to function, then they come back saying things like, I haven't used my inhaler and how long? Or, I've always had back problems, but since I'm coming here, I poop every day. I've been constipated for so many years, and now I'm pooping every day. Or they say things like, my kid is calmer. My child is calmer now when he's off his medicine, and I wonder if we're going to stop the medicine. Uh, I hear things like that. And people who have cough, people who have earaches, children with earaches, stuff like that, strep throats frequently. And not that we're treating the strep throats or the earaches, as Doc said. And you see the same thing in ozone. And you know what? The symptom is irrelevant, really. I love you as my client, and I really want you to feel better. I will stand on my head for you to feel better. And uphold the great name of chiropractic. Um, but I don't, I'm not treating your problem and your symptom. I'm not treating your symptoms. So when people come in, I let them dump their symptoms like the first time, and then stand back and let them report all these wonderful things that are clearing up in their lives. In fact, when chiropractic was discovered by restoring a deaf man's hearing back in 1895, they thought they found the cure for deafness. And all these people came to have their deafness fixed. And Dr. Palmer did the same evaluation, looking for the lump or a bump in the spine, which is the rotated subluxation, the vertebral subluxation, and he would adjust it. And the next person, I don't know about their hearing, but they reported that their heart problem cleared up. And then people with their long digestive problems were clearing up. But, there are limitations to matter. And if your biome is upset, the only thing that's going to fix that is doctor's biome. Or if you have Lyme into your tissues, or if Lyme disease into your joints or your tissues or your nerve system, there's only one way to get rid of that. I'll adjust you and you'll feel better, but only ozone's going to get rid of that. So there are limitations to matter. What we do is the basic thing of restoring the body's ability to heal. And after that, other measures that you use, that you employ, you'll have the most optimum benefits. But as long as you're doing other therapies with subluxated spine, you can't hope for the best outcome. That's all.
The key is to work, as you just pointed it out. It's teamwork.
Yes.
It may not be that you need to work as a team with another doctor, but it's teamwork. The spine needs to be kept in alignment, and then you have to have a healthy diet. You have to do exercise. You may have to do stretching, strengthening exercises. But the bottom of it all is it's teamwork. It's not just one of us doing everything. It's working together. You want to get a person well from Lyme disease. Yeah, ozone is going to destroy all those co-infections, but the back has gone out of alignment. You need the immune system to work correctly. You need to keep the immune system working maximally. Keeping the spine in alignment becomes the key issue and the key thing here. Let's go to our last commercial break, and then when we come back, we can come up with some of the other stuff that you do as a chiropractor that you've added into your practice that's been beneficial.
Okay.
We'll be right back. Let's talk about some of the other things that various chiropractic offices like yours has added into its practice, in addition to spinal manipulation, to benefit people, and some of the things you've seen from some of these other modalities that you have in your practice. I know you do a lot of different things. You have massage, you have all sorts of other things built into it. And it's good to know, because some chiropractors just do one thing and others do many different things. So we can talk all about those things as well. Also, we should discuss things, and we only have so many minutes when we come back from the break. Before I have to ask you to say, because I know people are going to want to get in touch with you. So I'm going to ask you to give your contact information. If you have a website, an email, certainly your office phone number, and say everything slowly and twice so that they can write things down. That's important. Fortunately, these shows, you can back them up and you can listen again and again. But I always like to say things twice and slowly at least. And we should also talk about how often people should go to get adjustment. Is once a year good enough? Is once a month good enough? You go to the dentist, they say twice a year for checkups and cleanings. Some people need to go more often than that. Everything is different, with different problems and different people. And I'm not one to say, wait until you're in trouble and that's when you go. So we're going to finish up talking about chiropractic. There's a couple of things I'd like you to go over as we were talking about during this break. How often should a person really go? to get a checkup and or an adjustment. And then let's talk about some of the other things that chiropractic typically does in their office, the different modalities that they may have and the benefits they may get from other than just an adjustment.
Okay, great questions. So first of all, how often should you go to the chiropractor? Well, first of all, if you feel screwed up, you should definitely go get adjusted and get cleared out. You know, your body, if you're feeling some kind of way, or if your vision is blurry or that kind of thing, go get cleared out. For someone who carries a heavy purse on their shoulder, they need to be adjusted every week. Somebody who has a wallet in their back pocket. It's number one cause of low back pain and sciatica. By the way, that sciatic nerve is the same nerve that feeds your prostate and your bladder and your colon. So if you're feeling pain down your leg, you better go get adjusted. Or somebody who does one-sided repetitive activities, or the nail tech who's sitting like this all day, or you slept wrong. If you sleep on your stomach, these are postures that create subluxations. If you have emotional stress, then epinephrine is being scored out and your muscles are tight and pulling your bones out of alignment. And unless you live on nirvana, you know, where you don't have stress, then you have, you know, emotional stuff every day that can create subluxations. Also, and as I mentioned, physical ways that you get subluxated, you lifted wrong, you picked up, you were raking, gardening, or whatever, go get checked. And then there's chemical ways that people get subluxated. It has to do with anything that we drink or smoke or medications we take, whether they're pushed or prescribed or recreational or over the counter. Food dyes, chemicals in our food preservatives, and pesticides on our fruits and vegetables, air that we're breathing that's not so good. All these things create subluxation. So unless you have a really perfect lifestyle where you're not exposed to these risk factors for subluxation, get checked. Maybe depending on what you're doing, once a week, twice a month. It really depends on the person. But if you're feeling something not right, you should definitely go get checked. Don't let those bad patterns be entrained in the nerve system and in the joints and the muscles and the ligaments and all that. What was your other question?
Well, let's talk about some of the different things. We have a few more minutes. Let's talk about some of the other modalities and therapies that you may find in a typical chiropractic office today. It isn't just simple back manipulation, spinal manipulation anymore. You all are in the 21st century with different things. I know your office offers massage and things like that.
Yeah.
So let's talk about some of these other things you offer and why you do. And I'm sure people will find other chiropractors offer similar.
You know, and I just wanted to mention one other thing. Do you think I get adjusted? How often do you think I get adjusted?
I would hope daily.
You're right on. You're right on. I'm checked every single day before I come in to see my clients. Because if I'm screwed up, how am I going to make you cleared out? Right? So my nerve system is checked. You have to be a clean instrument to make others clear and to be a healer. And not everybody knows that or does that. So yes, I am checked every day. So what other therapeutic modalities do we have in the office? Well, first of all, we have healing acupuncture, which is great at helping to balance hormones. And, you know, when somebody wants to get pregnant and we adjust them and it turns on their reproductive system, and it can happen a little quicker with acupuncture or to get rid of their pain. We also have physical therapy in the office. It's a great adjunct because it speeds up the program. As we're teaching your nerves and your muscles and your joints and your ligaments and all that to new normal patterns, and we have to break down old bad patterns, it's a process that takes time. I adjust you, get the pressure off the nerve so your body's working right, and then the physical therapist can help to maintain the adjustment and strengthen you so that it doesn't slide back out and you get the best results in the shortest amount of time. We also have this incredible laser that gets rid of pain, gets rid of inflammation, increases circulation, and it clears out swelling, which is great. And it takes away the waste products from inflammation and cell destruction. And it also hyperexcites the mitochondria in your cells, which are the powerhouses that make the energy, so that you have more rapid cellular repair and cellular healing and cellular growth. So this laser is a class 4, state-of-the-art, cutting edge, fully robotic laser that I bought because I got squeezed by a big nephew who wrapped his arms around me like a boa constrictor and crunched all my ribs. And I was like, I was out of commission. I couldn't even breathe or do anything. And this lady came to sell laser and she says, I can fix your pain. And the orthopedic surgeon said I wouldn't be working for 2 months. And you know what? In 4 days, I was back working and I said, I have your attention now. What is that thing? And so we can get rid of pain. People with bone on bone in the knees, people with shoulder problems and tears, and get them functional and moving and out of pain so rapidly. And for pinched nerves and for back problems and for jaw problems and for we're even doing tinnitus now and neuropathies, especially diabetic neuropathies, which I speculate it must improve the circulation to the feet and ankles and that kind of thing, and it gives them so much relief, and they're very grateful for it. So what else do we have? We have neurofeedback, which is what they do brain mapping. It's a very simple thing. It's a chiropractor in the office. The warranty gave out on her back, so she's not adjusting. And she does this wonderful technique that retrains the brain waves. So when you have all these different brain waves. When certain brain waves take you over, it can create anxiety and forgetfulness and attention deficit and hyperactivity and these kinds of things. So by neurofeedback, like biofeedback, you're watching a movie, and when those brain waves take over, the picture disappears, and then you have to get the picture back by getting rid of those brain waves. And it helped my child tremendously, who had attention deficit and couldn't focus, and now they do extended long projects and stuff in school. And so that's neurofeedback. And I do havening. Havening is a neuro-emotional technique invented by twin doctors Ron and Stephen Rudin, who are local to Long Island. And they wanted to find out, why do certain people get traumatized? If we could witness the same event, so maybe one of us would be traumatized and would screw up our life, and another person would be indifferent to it. They discovered why certain people get traumatized, what are the conditions for trauma to occur, and they discovered how to untraumatize, how to get rid of this receptor that jumps on at the moment of trauma. And it's amazing, it's astonishing, and I do it free for veterans to help them with their PTSD. And it has many, many applications, not just PTSD, but also panic and anxiety and attention deficit and all kinds of things. Havening.org is where you can look at it. It's very simple. It takes about a half hour, and it will accomplish in a half hour, maybe up to an hour, depending, what decades of emotional therapy can't accomplish. And that's pretty astounding. They should get a Nobel Prize for that one too. But so that's what we have in the office is, and we have very kind and friendly staff, very skilled staff. And I love what I do. And I love to be able to give the patients the results that they're looking for, and in a timely way. And I check up on them, and I'm in touch with them, and we treat them like family. And we take care of all people, regardless of their condition or their financial ability to pay. And that's how I practice, with ethics and with good adjustments.
Well, we both happen to be Rotarians, and this is what we do as Rotarians. We help people, and I think that's that's the difference between a doctor and a healer. We're at the end of the show now. I'd like you to give all your contact information, if you could, website if you have one, phone numbers for your office. Please say everything slowly and repeat it twice so everybody could write this down.
Okay, with pleasure. So it's Maxine Cappel, Cappel, Mayreis, Mayreis, and the office is located in Locust Valley, which is next to Glen Cove, where I was born and raised. That's on Long Island. The phone number is 516-759-7702, 516-759-7702. And the website is drmax.net. That's DOCTORMAX.net. DOCTORMAX.net. So that's the website. The laser is North Shore Laser Pain Relief.com. That's NORTHSHORELASERPAINRELIEF. Whoever picked one that long, I don't know. But in any event, you can call the same number, 516-759-7702, to find out about the laser. The laser is unbelievable. And the adjustments are unbelievable too. What else? What did I leave out? So you can always call me to speak with me. And my cell, I'll give you my cell because it's on my card and I enjoy speaking with people. 516, same as you, Dr. Robbins, 516-528-5955. That's my cell. You can call or text 516-528-5955. And it will be my pleasure to speak with you and explain anything or set up an appointment or whatever you want to do. Okay.
Dr. Max, thank you so much. I look forward to seeing you next week here at the house where you get ozone and I get an adjustment. And everybody, thank you all for listening to our show. Please tell your friends about it. Each show has a specific topic, as you've seen, and we try to go into it in detail to offer you the information you need so you can grow old and be well. That's what you want to do. If you want to reach me, you can go to my website, ozonedoctor.net, OZONEDOCTOR.net. You can call my office in Manhattan at 212-581-0101. That's 212-581-0101. Email me with questions, with suggestions for shows at ozonedoctor@yahoo.com, OZONEDOCTOR, Ozone Doctor, all spelled out, at yahoo.com. Now, remember to go to doctorsbiome.com and get Doctor's Biome. You won't be sorry. It comes with a 100% money back guarantee. In fact, if you don't like it, they don't ask you to send it back. They'll give you your money back and they'll let you give the product to somebody else who might benefit from it. You cannot lose with this. You won't be sorry. It can change your whole digestive system and help improve many medical problems. Last but not least, PromoLife. Go to PromoLife.com. Or call them at 888-742-3404, 888-742-3404. If you look online at the amazing array of ozonated products they have, their ozonated oils, their underarm deodorant, their dental products. These are things that could make major differences to your health and your life. Things that you couldn't fix before, you might be able to easily fix at home. So remember to go to promolife.com. Everybody, listen. It's been an honor and a privilege to have Dr. Max on. We have another great show planned for you next week. Everybody stay safe, stay healthy, and stay well. Goodbye now.